So I just had my knee replaced. I just had my hip replaced. Can I get the Aquacel dressing that was put on to those areas wet? Let's talk about that. So here, for this picture that I pulled up, you see here, this is an example of what an Aquacel dressing looks like for the knee. So that's a very typical look for those. This is the only one I could find that says for the hip, and that's probably because this is really more on the femur. It looks like, which is technically considered a hip surgery, but usually it's going to be higher up around the glute, and I guess they don't want to have just random pictures of people's behinds with this Aquacel dressing on the website. But that's typically what it's going to look like around like a hip or femur fracture. And up here, this is one thing I want to talk about. So with these types of dressings, you are, as I say, you're going to leave them in place, and you're going to leave them alone unless they start to get saturated with drainage. And this was an example, although I'll tell you I'm a little bit, well, I don't know if I'm 100% in agreement with both of these. But this first picture here, this is it says an acceptable amount of drainage on the bandage. And yes, this is very common that you'll see, especially around the knee replacements. If you're going to see drainage, not a big deal. Look at the second picture here that's on the right side, right side for me. And you can see where it says too much drainage. The thing that concerns me about this, I think it's probably the drainage in conjunction with the redness and an apparent swelling kind of around the leg. I think all three of those are kind of going to be a little bit indicative. Although I will tell you, the patient that I've had a patient who now there was no redness on the skin, but they had drainage looking like just like this. And I thought I was going to have to send the patient to the emergency room. I called the surgeon and spoke to the PA, and they said, "Hey, well, send a picture of it." So I sent a picture right then, and they called me back and said that looks beautiful, and it looked almost identical to this. So even though this says too much drainage, sometimes surgeons don't always consider that to be. But again, my patient did not have this redness around it, and so that redness of the skin and that swelling, that's maybe what is indicative. Usually the thing that you're looking at as far as these Aquacel dressings go, and drainage and what is too much, would be something akin to this, but all along it. Like usually what the surgeons will tell us that they are not wanting to see where it looks like this whole drainage or this whole bandage looks like it's about to fall off. That's the level of drainage that they're generally talking about, is too much drainage. So I don't know if I completely agree with this picture. But anyway, that's what they look like. So let's come back to me now. That's what they look like. That's where they're applied. Biggest question that we get using those things a lot of time is probably right after, well, probably just before, like when does this thing come off? Probably the most important question we'll get is, hey, can we get these things wet? And the answer to that is no. Well, you can't get them soaking wet. We'll say that. Soaking wet, if you get into a pool, you get into a tub, you stand in the shower and you just completely saturate that bandage, good likelihood the thing is going to come off. There is a possibility that it is going to allow microscopic bits of bacteria or anything like that there underneath the seal. So I mean, those are meant to be, the seals are meant to be really firm and tight to protect that, because that's what that whole dressing is for, is to prevent infection and to protect the incision site. But if you get it soaking wet, all bets are off. The adhesive there, it's not real, even though it seems like it's pretty thick, it's actually not on the skin real tight. I would say. And usually what we'll tell patients is, if you're going to get into a shower, stand out of the stream. And, I'll tell patients, to put saran wrap or press and seal over that Aquacel dressing, just to add some added protection there. If it gets incidentally splashed with water, not a big deal. That's what it is designed to prevent. But what it can't take is a soaking. You can't just completely just get it soaking wet and all that. So the answer to that question, with these Aquacel dressings, can you get those things wet? The answer to that is no. All right. I hope that this has been informative to you. I hope that your surgeries have all gone well, or are going to go well. And I will put a link to a video that I did, actually 2 videos that I've done about infections and clots and things to look for after the surgery. And so that talks a little bit more in depth about what we were seeing there on those Aquacel dressing drainages. So look for that at the end of this video, and catch y'all later. All right. Bye.